Can you keep a New Year's resolution? Believe it or not, only 9% of people actually achieve their goals. So as we begin 2025, New Year's resolutions are top of mind for many Ohioans. Today, I'm here with Buckeye Health Plan Medical Director Dr. Kambelos to make sure that we can make our health a priority all year round. Dr. Kambelos, thanks for being with us today.
Always a pleasure to be with you, Pete.
So I have to ask you, why is it that health resolutions in particular are such a big trend for people every year?
Well, New Year brings, fresh ideas. It's a new start. We're turning over a new leaf, fresh opportunities, and we're another year older. And as we get a little bit older, we start to think more about, the importance of our health. And particularly in the context of the last few months prior to the beginning of the new year, where most of us were fairly indulgent, overindulgent, in our diets, and certainly much less active given the colder weather and, again, the holidays.
Well, Dr. Kambelos, I know we mentioned so many people have a hard time sticking with those resolutions. What are some of the reasons that people struggle to keep their health-related resolutions?
Well, Pete, life happens. Life is what it is. Many of us work long hours, and some people work 1, 2, and maybe 3 jobs in order that they are able to support their families. And then there are obviously family obligations that take priority. Taking care of one's children, elderly and or aging parents, pets, or some combination of one or more of the above. Those things take priority. But let's keep in mind that as caregivers, we should make sure that we are in the kind of shape that's necessary so that we can take care of our kids, our aging parents, our pets, and fulfill those obligations. Look, the caregiver needs care, but regretfully, many times many caregivers just don't make that time to take care of themselves. Sometimes too there are naturally hiccups in life. An illness, an injury, unexpected home repair. And of course, let's always remember too that if we make our goals too complex, or if we make too many of them, it's going to be really hard to tackle all those effectively over the course of a year.
All right, so what tips do you have then to help people stay on track?
Well, it's always good to write the goals down, maybe even put together a calendar, plan that year out in advance, and make notes along the way, and try to stick to that as best you can. Now naturally, again, it's a tip, but life will happen, and it may not be that we're able to follow that calendar. But a couple other tips would be, like, let's say, for instance, when it comes to healthy meal preparation, that takes time, but maybe prepare those meals in advance, a week in advance. Make the meals, put them in Tupperware, and there you go. Your week is all set. Simplify some of the more complex goals and maybe trim that list down to goals that are a little bit more, I would say, manageable. That's a good tip, I think. And one other tip might be to engage, a health partner, a health buddy, to work with you, to remind you, and to keep you accountable.
All right, a lot of great information there. So what are some manageable health goals that maybe somebody can aim for in the new year?
Well, let's do 4 or 5, okay? And that may be a lot, but let's start with preventive care, okay? Number 1, preventive care. It's a good idea to really sit down with your doctor and set out some preventive care goals for the year. Let's think about those cancer screenings: colon cancer screening, prostate cancer screening, cervical cancer screening, breast cancer screening, our cancer screenings. Vaccinations, very important. Talk to your doctor about what vaccinations are important, for you, given your particular medical circumstances. Let's get moving. Start to get some exercise. And we're not talking about anything extraordinary, but maybe 30 to 40 minutes, 3 to 4 times a week of some sort of activity. It could be as simple as brisk walking. It could be a stationary bicycle. But bottom line there is to get moving. And then let's talk a little bit about diet. Unfortunately, our diets, probably all could use some improving. And some simple things that we can do to improve our diets would be to increase the amount of fruits and vegetables in our diet, for example. More water, more fiber, fewer simple carbohydrates, less saturated fat, less alcohol, less salt. Those types of things are relatively simple changes we can make, again, over time, over the course of the year. And then for those who smoke, let's look at cutting back on smoking, or ideally, let's cut it out.
All right. Well, these are all great goals to improve your long-term health. And Dr. Kambelos, how is Buckeye making it easy for members to achieve those health goals this year?
Well, our motto at Buckeye has always been, well, we lead with heart, and we are transforming the health of the community one person at a time. We sincerely care about our members, and it shows in how we surround them with all kinds of resources to help them along their health journey, including case and care managers. We offer free transportation to medical appointments, to and from. We cover at no cost to our members preventive care services and vaccinations. And let's not forget about these rewards dollars that are pretty important. You know, our members, by completing important preventive care services, earn actual rewards dollars that they can in turn apply to things like rent, healthy food choices, and other, you know, healthful activities to help them along their year.
All right, a lot of great information here. Thanks again, Dr. Peter Kambelos, for joining us. And for you at home, for more information, you can visit BuckeyeHealthPlan.com/preventative care.